Okay, we're gonna start. Well, good afternoon. Welcome to our webinar IHSS during COVID-19. This one is presented by Family Focus Resource Centers and Disability Rights California. My name is Josefina Romo de Char. I work for Family Focus Resource Center and our office of AB. I'm just gonna let you know, everybody gonna be in mute just to give the chance to our presenter to present without interruptions. And if you have any questions, you can put this in the chat. And at the end, we're gonna answer. And our friend Mary is gonna help us with that. And Myra and Christy is gonna be in charge of the chat, okay? So I'm gonna start sharing the screen for Maria. So give me a chance.
Okay, thank you.
Okay.
So, Mary, do you want to say a few words then?
Yeah, Josefina, do you want us to go ahead and start now? Is that good?
Yes, yes, it's perfect.
Okay.
Yes.
Okay. Well, thank you for inviting us. My name is Mary Rios and I'm with Disability Rights California. I am one of the senior advocates at Disability Rights California. Maria is going to do the presentation on IHSS and COVID-19. We ask if you have a specific question related to your direct issue. If you can send me an email if you'd like to make an appointment for a free consultation with Maria Iriarte, we can go ahead and do that. If you have general questions, please feel free to go ahead and enter your questions in the chat or the Q&A, and we will respond to your questions. If for some reason we're not able to respond to all the questions, what we are doing is getting all the questions and responding to them after. So with that, I will go ahead and turn it over to Maria.
Well, great. Thank you, everyone. And if you guys can't hear me, just let me know. So today we're going to be talking about IHSS in light of COVID-19. The first slide that you see there, this presentation was prepared by the women you see on your screen. I decided, why reinvent the wheel? We could use this for this presentation. So we're going to go ahead and go to the next slide. The agenda, we're going to do a little overview of the IHSS program, and then we're going to talk about some of the changes to the appeals process, providers, services, eligibility, applying for IHSS. What's next? I don't know if you guys know that there's a proposal to cut to have a proposal for a 7% cut across the board cut to the IHSS program that would be effective January of next year. But anyway, with that sad note, we're going to move on to the next screen. So we're going to talk about the IHSS a bit. Next screen, next PowerPoint. So what is IHSS? As we know, IHSS provides services to people with disabilities in their homes. There's also a part of IHSS that people don't really know about, and there are certain services like personal care services and meal prep that are provided at work. So if you need those kinds of services at work, you could use your IHSS hours and get the services at work. It was through a legislation called AB 9-5 that was passed a long time ago. So yes, IHSS is for services in the home, but there is this small exception for people to use it at work if they need certain services to be able to go to work. So the IHSS program, so the Department of Healthcare Services in California is the department that is responsible for the Medi-Cal program in the whole state of California. It's the only agency. They are the top. Like, they are responsible for Medi-Cal. Why do I mention Medi-Cal? I mention Medi-Cal because IHSS is a Medi-Cal service. So in order for you to even apply for IHSS, you have to have Medi-Cal. So Department of Healthcare Services said to the Department of Social Services, hey, we want you to administer the IHSS program for the state of California. So the California Department of Social Services administers the program for IHSS throughout the state. Now, the CJ IHSS contracts with the counties, and the counties do the day-to-day administration of the IHSS program. So that's why if you want to apply for IHSS, you're going to be calling the county. Next slide. So the kinds of services that IHSS provides they're in categories, like there's transportation services, protective supervision, paramedical services, personal care services, domestic services, related services. Those are the big categories of services. On our website, we have a self-assessment packets that you could, and it has all of the services broken down by, like, what's under domestic services, sweeping, vacuuming. You know, there are specific services that the program will pay for. So if you go to our self-assessment, you'll find each category with the sub-services that they provide. And those are all the, you know, you can't ask for anything that's not, you know, a service that the IHSS program does not pay for. So these are the general categories of services. So we're going to go to the next slide. So effective through June, which is this month, June 30th, counties have to focus. CDSS said to the counties, look, you need to focus on several things. You need to make sure you prioritize initial assessment. So anyone who is applying for IHSS, you need to prioritize that. Anyone who asks for a reassessment because there's now a change of condition, and including alternative resources, the loss of alternative resources, which I'm going to talk about later. You've got to prioritize. If someone wants to enroll to become an IHSS provider, you've got to prioritize. Counties should not be taking any action. You should not be receiving any notices of action that terminate the IHSS or decrease the services during this time. If you did get an IHSS notice of action doing something like this, you need to let us know, because we need to let people know that this is happening. At the very least, contact, you know, your social worker and say, look, hey, this isn't supposed to be happening. So you need to rescind or retract that notice of action. One very important thing, because we've been complaining about it, is that social workers should make sure that they answer and return your phone calls as soon as possible. I know that is a big problem out there, but you know, if that's not happening, you need to talk to the social worker's supervisor, and if you can't, then you need to let us know that this is not happening for you. Now, in this PowerPoint and throughout the PowerPoint, you're going to see, so for example, references to the all county letter. It's ACL 20-26, for example, this one. The information that you see on a specific PowerPoint and you see references to these materials, this is where this information is located. So if you're having a problem with the social worker is not answering your calls, and you talk to a supervisor, you could say, hey, according to all county letter 20-26, you guys are supposed to be answering the phone, returning the calls, prioritizing, you know, a reassessment because there's been a change in condition, you know, for example, the loss of an alternative resource as an example, and it's not happening, and you guys are supposed to be doing this. So that's the authorities that you would have in order to talk to the county about, you know, why they should be doing this and why they're not doing it. So that's really important. Next slide. So now we're going to talk a little bit about the application process. You know, you can apply at the county welfare office. Everyone who applies for IHSS has to have a health certification form. The IHSS forms, a lot of them have numbers at the bottom left of the form, and the health certification form is called the SOC 823. And before you can even, typically before coronavirus, before you would need to have that form filled out before services could even start. So you would have to have it filled out by a doctor. and submit it to the county, and then the county would take all of that information and then issue a notice of action. So once you've applied for IHSS, at some point in time, the social worker will go out to your home and do an initial assessment in person. And then, the county sends a notice of action approving or denying services. Typically, counties must make determinations whether you qualify for IHSS within 30 days. We know that it's not happening. We know that it's taking longer than that. If you don't have Medi-Cal and they're doing a determination of whether or not you qualify for Medi-Cal, they haven't made a determination of whether you're disabled under the Medi-Cal definition, then they have up to 90 days. You can always ask for most anything expedited. So if it's an urgent matter, you should ask for an expedited Medi-Cal application so that that could happen. And once you're on Medi-Cal, then you can apply for IHSS. So the next slide. So what's happening with the health certification form in light of coronavirus? Like I said, typically you have to have it returned to the county before services can even begin. However, currently, if you're at risk of out-of-home placement, you can receive IHSS services for up to 45 days while the county waits to get the SOC 873 from you. If you need more time, then you need to call the county and say, I need additional time to submit the form. I have good cause for it, and the good cause is defined by the regulation as substantial and compelling reason beyond your control. So for example, I could say, my doctor's office is closed, they're not responding, I need more time to figure out how I'm going to get this done. I think that's a substantial and compelling reason in light of coronavirus. You'll see in this PowerPoint references and the other PowerPoints to MPP. The MPP are the regulations for IHSS, Manual of Policy and Procedures. Section is where you're going to find this information, 30-754.641. All of the IHSS regulations are found in the CDSS website. So you can go to CDSS, California Department of Social Services, and look for the IHSS regulations. They're all there. It's really important that you know where this stuff is, because if you ever appeal or you're ever dealing with a social worker and they're telling you one thing and you're not sure whether what they're telling you is right or not, then you can go to the Manual of Policy and Procedures and look up what the rules are on whatever the issue is. You can call us. You can call a lot of legal aid offices also do IHSS. So, there are resources for you to figure out whether what you're being told is correct or not. So just know that if you're applying for IHSS and you need more time to get that form to the county, CDS is saying to the counties, you need to make it happen. Again, additional resources for the information you see are in the All County Information Notice. There are different things, All County letters, All County Information Notices, but all of it is the goal is to send information to the counties about the IHSS program, policies, and that kind of thing. So you've got the authority there for what is being said there about the SOC 873. So we're going to go ahead and move on to the next slide. So talking about initial applications, they can be done by video, so through Skype or FaceTime, during this period of time. If they're done by video, then the social worker supervisor is going to have to review it and approve it. Now, it is possible that the social worker may want to do a face-to-face assessment. But the counties are supposed to collect as much information as possible by phone before they go out, because they don't want to expose you or expose their workers to anything, really. And so they want to spend the least amount of time in your home if they have to go out and do a face-to-face. So social workers should be getting a lot of the information by phone if they're going to go and do a face-to-face assessment. And they're going to ask you if you've been exposed to COVID-19 before coming to your home, or if anyone has been exposed. And if a social worker has been exposed or has symptoms, they can't come to your home. So, you know, you need to ask that question too. You know, have you been exposed? Have you been around anyone who has? Because I think it's a valid reason to say, you know, I'm a little concerned about you coming here, especially because, you know, a lot of people are vulnerable. And, you know, so, you know, I think it's a conversation to have with the social worker. And if they do come out to your home, you know, they've got to wear the personal protective equipment and keep a safe distance from you. Really important. And where is all this information? Well, it's in the information you see at the bottom, the All County Letter 20-26, and then All County Letter 20-42, and then the information is there for you. Next slide. Annual reassessments. You know that once you get on IHSS, you are reassessed every year. It's supposed to be an in-person reassessment that social workers come to your home. Well, these reassessments have been suspended through June 30th, so through the end of this month. They should be complete. In other words, they're not going to be in home. They shouldn't be in home. And they should be completed by phone. And the county should be prioritizing those reassessments where there's been a change in your circumstance that would result in more IHSS hours for you. If the face-to-face is needed, they're going to, again, collect, you know, a lot like the initial assessment, they need to collect as much information. And also during this time, at least until June 30th of this year, you know, they shouldn't be terminating your IHSS or reducing services. And the information, the authority for that is in those all county letters listed there. Really important that not happen. So we're going to go to the next slide. Okay, so what is a notice of action? Once the social worker comes out to assess or reassess, they're going to issue a notice of action. If you've never received, you know, so you're going to have on the top right hand corner of the notice of action, you're going to have the date of the notification. Let's say that the date of the notification is June 1st for purposes of this explanation. June 1st is the date that they issued the notice. I received the notice, and the notice tells me that I've been approved for 250 hours of IHSS. And it'll say, and there's a rectangle there. The first rectangle will say, effective June 1st, you're going to be receiving 253 hours of IHSS. And then it'll go on to explain the categories of where I'm getting the hours. You see all of the services are listed there. It'll tell me how many hours I'm going to get and how many hours monthly at the very bottom. If the application is approved, that's what it's going to have, right? Every notice of action is going to have your appeal rights. But if you're happy with what you're getting, you don't have to appeal. But if you're not happy with what you're getting, or the effective date of services, then you need to, or you might want to think about appealing. If they deny something or reduce something, they need to tell you why they're doing it. They need to cite to the MPPs or whatever other law they're relying on for the action they're taking. It has to be in the notice of action. Let me say to you that I've seen notices of action that don't necessarily have that information, or they have one reason, but then after you appeal and you talk to the appeal specialist, you start to get other reasons. Yes, that's not an adequate notice, but it's supposed to. And if that's why if you appeal, you're going to have the opportunity to talk to an appeal specialist. It's a person who is going to represent the county at the hearing. You should have a conversation with the appeal specialist and say, hey, I just want to make sure I understand all of the reasons. The notice says that the reasons for denying or reducing services is this, this, and this. Is there anything else I need to know? Yes, you can tell the administrative law judge that your due process rights were violated because the notice of action didn't have all the reasons. But in reality, the administrative law judge is going to say, okay, so do you want to continue the hearing so that the county can issue a new notice? You seem to know now the reasons. Do you want to just go ahead with the hearing? It's not that they don't care about it, but it's like, if you've spoken to the appeal specialist, then and you know the reasons why, it's not a surprise anymore. And I don't agree that they should do it this way, but I see it. I've seen it. I've been doing this for 20 years and I've seen it. So when they send you a notice reducing, terminating, or somehow changing your services, they have to send that notice at least 10 days before the effective date of the notice. Not the date of the notice, but before the effective date of the notice. So if anything you learn from this slide is that there are 2 dates that you are concerned with. The date of the notice, but more importantly, the effective date of the notice. Now, so let's go to the next slide. Okay. So if you disagree, you need to file an appeal. So you have 90 days to appeal a notice. Okay, that's what it is. However, if you've ever received a notice, then you can always appeal. You don't have to wait for the county to send you a notice to call the State Fair Hearings Office and say, hey, I need to appeal this reduction or termination of the service. I never got a notice from the county. I had a client recently who she waited for the social worker. She asked for an increase in hours because her son was back in home and he wasn't going to school and it was no longer an alternative resource. I'll talk about that later. And she called the social worker and he says, yeah, I'll send you the notice. And she spent over a month and a half waiting for the notice before she spoke with me. And I said, you know what, forget it. He's had enough time to send you the notice. What you need to do now is call the State Fair Hearings Office and ask for a notice. And she did. And so what happens? What happens is then the county gets notice that you've appealed, and then you've got an appeal specialist, and then you have someone who's now doing something, right? And it's possible that her issue will resolve and that'll be it. But it's important to know that you should get a notice. But if you don't get a notice, don't think that you can't appeal. You can. And so it's really, really important that you know that. The other thing to know is that if you are receiving services and the county's IHSS services and the county is reducing or terminating, if you appeal before the effective date of the notice, you can get what is called aid paid pending, which means that there will be no change until there's a hearing decision. And if you win, obviously there won't be a change for the worse. You might even get more hours. And when you appeal and ask and get before the effective date of the notice, you have to ask for aid paid pending. The back of the notice will tell you what to do, but if you appeal before the effective date of the notice and you don't ask for aid paid pending, you're not going to get it. You have to affirmatively say to the state fair hearings person who answers the phone and takes down your appeal, I want aid paid pending. This is really important because your services will not terminate or will not be reduced until there's a hearing decision. We're going to go to the next slide. So this slide really talks about Medi-Cal fair hearings. We're not talking about the IHSS fair hearing at this point. These are just deadlines for when you have a Medi-Cal issue. They're giving you more time to appeal. I have not heard that it's changed through the IHSS program, although Medi-Cal is. But at the very least, you have 90 days, and it looks like you may even have 210 days. But this is supposed to be I'm not sure through when. This slide also says that the state is only conducting phone hearings through May 15th. Updates, they're continuing to do phone hearings. So if you ask for an in-person hearing, and the state fair hearing sends you a letter saying your hearing is set for a phone hearing, you can call the state fair hearings office and say, no, I want an in-person hearing. And then they're going to say to you, well, yes, you can have an in-person hearing, but we don't know when that's going to happen. We don't know when we're going to start, having in-person hearings. If you're getting aid paid pending, it really doesn't matter. They can extend it another 9 months if for all you care, because you're getting aid paid pending. But if you're not getting aid paid pending, then you need to think about whether you want to have that hearing, whether you want to have an in-person hearing, who knows when, or whether you just want to go ahead and do a phone hearing. It's really your decision to make at that point. Here, slide number 14, how to request a fair hearing. That's the information. It's in the back of the notice of action. So we're going to get to the next slide. Now we're going to talk about providers because there's been a few changes to IHSS provider requirements. Now just generally speaking, to be an IHSS provider, you have to be legally allowed to work in the U.S. So whatever permit you have to work in the United States, then you meet that requirement of being a provider. You have to also do an orientation. I believe it's a 3-hour orientation. I don't know. It would typically be in person usually at the Personal Assistance Services Council. It's the organization that does the orientation for new IHSS providers. It also has a registry, so if anyone wants to find a provider, they can call the Personal Assistance Services Council and get a list of names of providers, people who want to do IHSS work.
You can go to the next slide, Josefina.
You can do the orientation online. So you won't have to go in person and do it. Also, when you're signing up for a provider, you have to provide original identification documents and a form called the SOC 846. But due to coronavirus, you can do it by mail or online. We're going to talk a little bit more about the background check in a moment. If you want more information on how to enroll as an IHSS provider, you've got the link there to the CDSS website. Next slide. I want to talk a little bit about IHSS providers for children under the age of 18. So if you have a child who is 18 or over, this does not apply to you. But if you have a child under the age of 18 and you want to be a provider, this is the regulation that tells you when you as a parent can be a provider. So in order for a parent to be a provider of a minor child, you had to have left full-time employment, or you're prevented from obtaining full-time employment because there's no other suitable provider available to take care of your disabled child. And if you can't provide the services, then that may result in inappropriate placement for your child or inadequate care. And that MPP that you see there is the MPP that's the regulation for parent provider. That same regulation has information on when someone can be a provider who's not a parent for a minor child. Can you work part-time and be a parent provider? Yes, you can. I've heard county workers say to people, if you're working part-time, you can't be an IHSS provider. That's not true. These are the regulations, and you can cite to the regulations and say, no, it's only if you're working full-time. So what does it mean by suitable provider? This comes up when, for example, you've got a two-parent household. So in order for me, for example, let's say I want to be a provider of a minor child. I have my husband here with me at home. In order for me to be the provider, my husband has to be not suitable. In other words, what does that mean? I can be the provider while my husband is working, while my husband is going to school, while he's looking for a job, and that's about it. Because if my husband is considered suitable, if he's not doing one or a combination of those things, then he's considered a suitable provider, and that will prevent me from becoming an IHSS provider. Next slide. So this slide just summarizes, the first part summarizes the parent-provider regulation. In a two-parent household, the second parent is considered unavailable. Like I said, when the parent is working, when that second parent is going to school, when that second parent is looking for employment, or when that second parent mentally or physically cannot, because of disabilities, cannot take care of the child. I represented a mother who worked full-time. Grandmother took care of her mother's minor child, and mom got a notice saying, well, we know that you work, but when you get home from work, you should be taking care of your kid. You're now available. Well, we went to hearing, and we were able to prove that mother, because of her own mental disabilities, was unable to take care of her child when she returned from work, and in the evening. And so that's why grandma was taking care of the child. And so we won. So we used that part of that regulation to show that mom was not available, and therefore a non-parent provider like grandma could be a provider. So during COVID, if, let's say, for example, I am the IHSS provider and my husband is furloughed because of COVID-19, he can't go to work. Up until the end of this month, even if my husband is at home and he's not working and he's not looking for work and he's not, he doesn't meet the other requirements, it's okay. I can still be the provider, because otherwise I could not be the provider under the regular rules. But this is only until the end of this month. And note the bottom, it says, IHSS parent providers will no longer be allowed to work as of July 1st if the second parent is still out of work or is not in an educational or vocational program or conducting job searches, or is not prevented from providing, it's not prevented due to a physical or mental disability to take care of the child. So if you're a parent, if this is your situation, know that it's only good until the end of the month. And then July 1st, it all goes back to the usual rules. Caveat: these deadlines can change any day. Currently, these are the deadlines. Tomorrow, the deadlines could be extended, could be changed. I would say to you, because sometimes it's hard to sort of follow everything that's going on with the budget and everything, and COVID, not only with IHSS, with schools, with regional centers. I mean, there's so much going on. I would say to check our website for updates on what's happening with IHSS. You can also go to the CDSS website and check for updates as to what's happening with IHSS, if there have been any extensions to some of these rules. But currently, this is what it is. Like I said, it could change tomorrow. They can't make it less than this. In other words, they can't tomorrow say, oh, so this rule about the second parent being in the home, we're only gonna allow it until the 15th of June. They've already said that they're going to allow it to the end of June. Okay, they can extend it if they want, or they can just drop it at the end of June 3rd and say, you know, starting July 1st, we're going back to our old rules. Need to know that. Next slide. Okay. So, effective April 10th to June 30th, CDSS, meaning the counties, will waive certain provider enrollment requirements. So we talked about photocopying of original documentation. Copies can be, you know, copies of documentations, because you don't want to give your originals, right? So copies of identifying documents that they need, you could mail to the county welfare office. And so providers can be enrolled while the county waits to receive these documents. But you do have to, as a potential provider, you still have to attend the online orientation. The provider enrollment agreement, that SOC 846 that was mentioned earlier, you can submit by mail or online. And the orientation, of course, you can do online. And there's a designation form that as a provider you have to fill out, that tells the county how many hours a month you're going to work for this person. You have to sign it. It's a very simple form. It's called the SOC 426A, which is found at that link. You still have to complete that and send it in if once you become a provider, or if you're a provider and the hours are going to change, you always have to fill out a form and send it in, because if you don't, then the county doesn't have this information, and you submit a timesheet that differs from what they have. It's going to spell trouble, and it may take a while to sort it out. So what I recommend is that you call the social worker and say, hey, there's going to be a change in time for my providers, or there's going to be a new provider, and I'm going to, how do I get these forms to you? It just depends on the office that you're dealing with. So, for example, for one person I worked with, I go through the supervisor and I say, look, I can't get a hold of Mr. So-and-so, the social worker, and so I'm sending you these documents. Can you please forward them to the social worker? And he's always been very kind, and he'll do that. And so, it's just, figuring out how to work with your social worker and the supervisor to get the documents that you need. And like I said, the county's supposed to help you do this. They want it. One of their priorities is to prioritize you becoming an IHSS worker, right? Next slide. So I want to talk about emergency backup providers. There already exists an emergency backup system. So let's say, for example, I'm a recipient of IHSS. And my provider calls me this morning and tells me I can't come in. And I'm like, oh my gosh, how am I going to do everything I need to do? I can't even get out of bed with assistance. I can't eat. I can't, there are many things I can't do without someone here. I can call the Personal Assistance Services Council and say, I need an emergency backup provider. And they can help you. And what we're going to talk about now in this slide is a little different. Because the emergency backup provider system is through the Personal Assistance Services Council. It's the same entity that provides orientation. It's the same entity where you could go find providers. So CDSS has told the counties that you guys need to create a backup IHSS provider system. And it should be available through June 1st. I think that may have been extended because why do something and then not have it? And it takes time for the counties to do this, right? So if the Personal Assistance Services Council is not, if your provider cannot work because of COVID-19, then you should contact the social worker and say, I need an emergency IHSS provider. And if they say to you, I don't know what you're talking about, we don't do that. Guess what? You have the all-county letter 20-29 that tells them that they're supposed to be doing this. And in fact, yes, you should be helping me with this. And so it's really important. Monterey County Aging and Adult Services, I think this PowerPoint was done for them, so I think that's why they have that information. But you should be contacting your local county welfare office where your IHSS social worker is housed to talk about, an emergency backup provider because of COVID-19. They tell you to, next slide. So they tell you make up, CDSS, and you'll see online, they say, you need to make a backup plan in case there's an emergency. Like, what is the medication you're taking? What equipment are you using? What are the ways that you can meet your needs if there are no service providers, if there is no provider to come in? Do you have friends, family, ready, willing, and able to come in if you need them to come in? Because, maybe Personal Assistance Services Council can't get you the person that you need, or maybe the county can't get that. You need that person today. So, it's like, yes, these things should be happening, but in reality, sometimes they don't. And so you need to be proactive, and you need to think about what your needs are and how you're going to meet those needs, right? There's a website there for how to put together a backup plan. You can always call 211. That's they're a fountain of resources. Maybe they can help you identify resources. Also, your independent living centers. There are independent living centers that are available to people with disabilities, and they're aware of the local resources that are available. And at the end of the day, if you are not, if your health is failing because you're not getting the services that you need to think about calling 911 and getting yourself into a hospital, really, because you don't want to get to a point where it's not good for you. So the lesson from this slide is that you really need to think ahead and think of ways to get what you need. Next slide. Let's talk about alternative resources. So on the right-hand side of the screen, you see a notice of action. Alternative resources are IHSS services that are provided, for example, by another entity. So let's say that your child goes to school, and during school your child is fed. They need feeding, so someo's there to feed them. Maybe they need bowel and bladder. Maybe they need help moving from here to there. So if there are any IHSS-like services that the child is receiving at school, if a child is receiving protective supervision, of course, then that means he's receiving supervision at school. Someone who's an adult may be receiving community-based adult services. These are adult day health care centers where you're picked up in the morning. These are seniors. They take you to a center. There are nurses, social workers. They feed you. There are activities. They take care of you. They feed you lunch. They take you back home. For regional center clients, for example, it could be a day program. If you go to a day program where you're receiving IHSS services, like services, then those are all alternative resources. So what happens with these alternative resources? The county will decide how many hours you need in total, and then they're going to deduct hours for alternative resources. And you'll know where it is, because the alternative resources is the column that says services you refused or are getting from others. So if you ever question what that meant and wondered why they took up the hours that they're taking in that column, well, that's what it is. But the notice may not identify what the alternative resource is. They may just say, oh, you have an alternative resource, or you're getting services from others. And what if you're a person who's getting alternative resources from various sources, or you go to different programs? You should ask your social worker, so explain to me why you're deducting these hours and what you consider to be the alternative resources, right? Okay, let's say that you understand that your child the hours were reduced as alternative resource because your child goes to school and your child is getting IHSS services in the form of protective supervision. So the county will reduce your child's hours by the number of hours that he's in school. But guess what? As due to COVID-19, kids are now at home and they're being homeschooled, right? Or when they're at home during vacation time, there is no alternative resource anymore. So if your child is at home due to COVID-19 and not going to school, or whatever other alternative resource was identified by IHSS and they're no longer going there, then you should be contacting the social worker and saying, there's no more alternative resource. As you know, kids are now, for example, in my example, my child is now home and being homeschooled. You need to increase my hours because there's no alternative resource. Ask for alternative resource due to a change due to COVID-19. You see the authority down there? That's the authority. I can tell you, I've heard of parents calling the IHSS social worker asking for this, asking for more hours due to alternative resources not being available anymore. I've heard social workers say to people, oh no, we can't change anything. We can only assess you once a year. That's not true. Whenever there's a change in circumstance, they are required to reassess you. CDSS has a directive to the counties, and the links are there, that says that they are to talk to you about this. They are to increase your hours if you're not receiving those alternative resources. And so this is really important. And you should be asking for an increase in alternative resources from the time that your child started lost going to school. So if it happened April 15th, you're going to say, I want you to increase my hours as of April 15th. And if you get no, or they don't do enough, first you need to get a notice of action. And you need to tell the social worker, I want a notice of action with the reasons why and the authority that you're using to deny me this. And like this other lady who waited a month and a half and never got the notice of action, you know what? Just go ahead and file for a fair hearing. If you don't get a notice of action, If the social worker says to you, I'm going to mail it to you, and a week goes by and you still don't have it, I would say, you know what, just call and ask for a fair hearing. And you've got the authority there that says that they're supposed to increase the hours. So you've got, and the authority, these all county letters a lot of times refer to the regulations. And so, you know, this is really good information for you to self-advocate. Next slide. Now, if you can't reach your social worker, there, you know, the advice is to document your request and adjust your hours by following the steps that are listed here in this PowerPoint. You identify the alternative resource, and then you identify the task which was reduced. You know, what is the alternative resource? Was it school? Whatever. And like it says in this PowerPoint, counties don't always identify the alternative resource. And identify the task that you now need help with because the person is no longer has that alternative resource. The next slide is a sample letter that you send to your social worker saying, you know, I'm sending this letter to request approval because I need, you know, more hours because of loss of alternative resource. And what are the hours that you're asking for? And, you know, and see what happens. I think I've heard it. I've heard the advice to go ahead and adjust your hours and submit your timesheet with adjusted hours. I honestly don't think it's as easy as that. And I just, my own feeling about doing what I would do, because I've been doing this for a long time, is that I would send the letter. If you can't reach your social worker, if you can't reach the supervisor, I would send the letter in. But if I don't hear from the social worker in a certain time, say within a week and a half from sending the letter, I might just file for a fair hearing. I already have the authority I need for what I want. And then at that point, like I mentioned earlier, I'm going to be able to talk to an appeals specialist about this, and they may resolve the issue for me, especially when I can provide them with the authority for what I asked. So, you know, that would be my, you know, the way I would do it. If you're having real issues with the worker, then you can always reach out to us also, and maybe I can place a call, or, you know, kind of go up the chain of command to see what's going on. Or I might just say, like I said to the client's mother I was talking to, I said, just file for a fair hearing. She did. And I said to her, when you get the letter from the appeals worker asking to contact him or her to try to talk about the case, we'll get on the call together and we'll explain everything and see what happens. But, you know, sometimes it takes a little while to resolve matters. Next slide. Overtime violations. You know, when you get 3 overtime violations, you could be taken off as a provider. We've got a publication about overtime rules. That could be a training all in and of itself, and you know, you want to avoid getting a violation. But because of coronavirus, counties have to be more flexible with IHSS recipients and their service hours, so that IHSS recipients can get what they need during this time. If you get a letter saying that you have an overtime violation while performing services that are in critical need, then the violation should be removed. The authority is there for that proposition. Unfortunately, we could not find what in critical need means, but I think that you can make an argument that you know, you had to, for example, the other provider didn't come in and you ended up having to spend a lot more time than the time you were allotted, or more time than the client was allotted to take care. Maybe the recipient got very ill and needed more services, and you were required to perform more than what was necessary, more than what was approved. By the way, you can only get 283 hours in the IHSS program, so this doesn't mean that you can work 400 hours. It just means that, you know, if you go above and beyond what you were assigned, then you need to, you know, and if you get a letter and you have issues with it, you can always call us, but it doesn't mean that you should go run out and do overtime, you know, and they could deny that it was a critical need. You know, it's not a given that just because you go overtime that they're not gonna count this as a violation. So be careful with, you know, your hours, and if you have any questions about what you should do about working more time, maybe if you're a union member, you should call your union and have a discussion with someone who could give you more advice. Or you can call us and our intake line, and someone can talk to you about that. So let's talk about, next slide, provider sick leave during COVID-19. So there is a whole thing, a whole sick leave sort of procedure. So as an IHSS provider, you're entitled to sick leave. We're not talking about during the time of coronavirus. Anytime there's a sick leave policy for IHSS providers. There's a whole section on CDSS website about the regular IHSS provider sick leave rules. I don't know them by heart, so don't ask me. But I can certainly send you the link if that's what you want. Now, there's this new sick leave during COVID-19. So no, there's a sick leave policy that is in effect, has been in effect for a while now, that continues to be in effect and into the future until there's a change. But there's this new thing now. So effective April 2nd to December 31st, IHSS providers and waiver personal care services providers, if you're on a waiver and you're getting waiver personal care services, you're entitled to paid COVID-19 sick leave, different than the other sick leave I talked about. You can get, it's for providers who work 40 or more hours per week, can get 80 hours of sick leave. Providers who work less than 40 hours a week can get an average number of hours worked over 2 weeks. And so when can you get sick leave? If the provider's in quarantine or has been told by a doctor to quarantine, has COVID symptoms and is seeking doctor's help, is caring for someone with COVID or has been told by a doctor to quarantine, is caring for a child whose school or child care is closed or has another COVID-related problem. There is a form that you need to fill out to ask for the sick leave. The information is all there in the links that you have. I had a question from someone who said, can I take like partial hours of this COVID sick leave time, and like, could I take 20 hours now and 20 hours later? I looked it up, and what I found is that apparently you have to take the 80 hours consecutively. In other words, all at once. But there's more information on the website about this. So do look at the links that are there. Again, it's a different kind of sick leave than the sick leave that normally is available to providers. And it's only effective until the end of December, until further notice. Like with all of these dates, until further notice, you know. So next slide. So personal protective equipment. The public authority is providing this equipment for people for providers who care for individuals with suspected or tested positive COVID-19. I know for a fact that the State Council on Developmental Disabilities is also handing out, personal protective equipment. I know for a fact that I know one in particular has given some of this stuff to schools. So, you might want to go on the State Council for Developmental Disabilities website to find out how you can get, personal protective equipment from them, perhaps. And more information on COVID-19. Those are our publications. So I'm now going to open it up for questions. Are there any questions?
There are no questions in the chat. I don't know if anybody has any questions.
There's a lot of information here for every subject. Fortunately, you've got the links to publications and documents that will give you a lot of the detail. If for some reason you look up this information and you still don't have the answer to your question, you can always call us and we can look into it for you. And Mary, do you want to talk about the intakes?
Sure, I can talk about the intake. So we do have pre-intake. Give me 1 second so I can show my camera. Sorry. So hi everybody. So we do have an intake process. Our intake line is 800-776-5746. What happens is they take they do an intake, and then they assign it to an advocate that specializes in that area. And what will happen after the intake is done, it's presented to a practice group, and the practice groups consist of attorneys and advocates that specialize in that particular area. And they review the intake to see if the appropriate advice was provided, or if they need to follow up further or set up an appointment with one of the attorneys. So that is our intake line. We can also do an intake via web on our website. But if you'd like to make an appointment with Maria, if you want a consultation with Maria, it doesn't necessarily have to be on IHSS. It could be on any subject, on Social Security, on IHSS, on any question that you have. We can certainly set up an intake. I can go ahead and give you my email address. It's mary.rios@disabilityrightsca.org, or my direct line is 213-213-8151. So with that, I don't know if you're welcome, Maria. I don't know if anybody has any questions.
I just wanted to make sure people understand that if you contact Mary, she has to we have to open up a file for the client, the person with a disability. And if you're regional center client, we have to do a conflicts check with our sister organization, the Office of Client Rights. So when you call Mary, it's possible that you're not going to be, your question will not be answered on that same day. And then what happens is that once we open up the file, my secretary makes an appointment with me so that we can talk. So, unless it's an urgent matter and you identify it as an urgent matter and explain why it's an urgent matter to Mary, there will be, at least a few days that go by between the time that you contact Mary and we eventually talk.
Thank you, Maria.
Thank you.
Is there Josefina, do you have anybody that has? I didn't see any questions in the chat.
No, I don't have questions here. I have a question.
Okay.
Okay, my question is referred to the sick time, because there is a lot of confusion of people think about they can take care of their family member and also take the sick time. You know, like report the,
Consecutively.
yeah, report the
Okay.
hours, and also take the sick time. And I trying to explain them that you can take both, but it's a lot of confusion about it. Can you explain more a little bit about that?
Maria, were you able to hear her question?
I think what she's talking about is people think that they can take sick time and still take care of the IHSS person.
Correct.
Yeah, I mean, logically, it doesn't make sense that you would take sick time. When you take sick time, it's because you can't provide the service. So if you can't provide the service, then how is it that you're providing the service? Then you wouldn't be taking sick time, right? But the COVID-19 sick time, you should look at the form and the website there, because it does go into more detail as to when you can take it, what's the criteria for taking it. So I would invite you to look at that information first.
Thank you.
Thank you, Maria.
Any other questions?
There is a question from Maria. Does a medical form need to be filled out every year?
I don't know. I mean, the forms at the doctor, you know, is this a person who needs, you know, assistance with activities of daily living? Is this a person who risks being, you know, placed away from home because they're not going to get, you know, the services they need to be safe at home? So it's asking the kinds of questions that, that it's the criteria for meeting IHSS. I've never been asked that question. I don't know what the answer is, but my gut reaction is that if the county feels that they need to get an updated form, maybe they went and had a reassessment and they noticed there have been changes, and maybe they question whether the person should continue to receive IHSS. Maybe they want another form filled out by the doctor. And so I can see circumstances where a social worker may want, you know, an updated form filled out. Mm-hmm. It's just like the SOC 821s. I mean, for protective supervision. Yes, your doctor filled one out last year, but they're gonna, you know, they can ask you for another one this year, or a medical form.
Right, or the child's or the individual's condition may change, where you need to ask the doctor to include more information.
Right.
Any other questions? No?
Very clear information.
Thank you.
Yeah, you're welcome. So, you know, so thank you everyone for taking the time this afternoon to be with us, and we hope to be able to be with you again, talking about other things.
Yes. There is somebody did raise their hand.
Okay.
Can you unmute Galaxy?
They need to unmute themselves, because I tried.
Galaxy, can you unmute yourself? Galaxy tab, it says.
I can't. For some reason, I can't unmute him or her. No.
Can you type it in the chat if that's possible?
Can you type the question in the tab, or if you can unmute yourself, you can go ahead and ask the question.
The other thing we can do, if your group comes to you with further questions, you can send them to Mary, and I can answer them. You know, we've done that before, where we don't have time to answer everyone's questions that were on chat, and or they come in later, then we take them all and we answer them and send them to the group leader, and then they can distribute the questions and answers to everyone so that people have the benefit of the information.
So, yeah, if you get the questions, Josefina, if they have any further questions, you can certainly email them to us, and Maria will respond to them.
Okay, perfect. If anybody wants also the material, you can leave your email in the chat, and then we can send it to them.
Thank you so much. Thank you, Maria.
Thank you so much.
You're welcome.
Happy evening.
Bye-bye.
Yeah,
Bye.
same. Bye.